Professor Trudie Chalder, many thanks for joining us today in this Spotlight video. First of all, could you say a little about yourself and the work you do at King's College London?
I'm Professor of Cognitive Behavioural Psychotherapy in the Department of Psychological Medicine at King's, and I'm also the Director of the Persistent Physical Symptom Treatment Unit in the South London and Maudsley NHS Trust. And I've been interested in fatigue for about 30 years now and looking at factors which contribute to the development and maintenance of it, and we've been developing treatments to overcome it.
Thank you. And we'd like to talk today about fatigue and the extreme tiredness that people are reporting after infection from COVID-19, and also any insight you can provide into how best to support the recovery of these patients, but also perhaps into why more generally some of us may be experiencing a level of fatigue from the experience of lockdown and coping with the pandemic. There have been numerous reports of COVID-19 patients suffering long-term fatigue. Is this usual after a viral infection?
Yes, I mean, the research that's gone before suggests that after a serious viral infection, such as hepatitis, meningitis, Q fever, glandular fever, that fatigue is very common after those infections.
Thank you. And why does it seem to affect some people much more than others?
Well, that's a good question. I mean, certainly the research would suggest that some people may have a biological predisposition. I think it's true to say that some people who are more prone to distress and or fatigue, that they may be more vulnerable and they develop fatigue after an infection. We also know that the longer people convalesce for at the onset is associated with some delayed recovery. But the caveat obviously to that is that when you're in an acute stage of illness, you do need to rest as soon as you start to feel better, that you start engaging in activity again.
Thank you. And building on that, what are the main recommendations on how to manage this type of post-viral fatigue and to help recovery?
Well, we know from work in other types of nasty viruses that the important thing is to get back to activity as soon as possible. And obviously that has to be done carefully. And for many people, if they're just given some guidance about how to be more consistent in their activities and how to build up gradually over a period of time, as well as developing a very regular sleep routine, that then they will improve and get better. For some people, they may actually need some additional help from a health professional.
Thank you. And thinking of those who may not have been ill with COVID-19, does it seem that fatigue or lack of energy is a general problem in this type of lockdown situation? And how best, I guess, can we manage it?
Yeah, I mean, I think lockdown has been challenging for a lot of people, particularly loneliness. I think we found in our research that loneliness seems to be associated with more distress in people in lockdown. I think also people have been quite fearful in terms of getting the virus itself and the consequences of that. So I think there are a number of different risk factors. I think for some people, though, being in lockdown with their close family can also be challenging because, of course, most of us don't normally live our lives like that. So that can be difficult. In terms of what you do about it, then obviously I think we're starting to come out of lockdown. So I think that should ease some of the pressures. On the other hand, there are going to be different pressures that people are faced with, such as unemployment, difficulty going back to work, the worries about maybe travelling again in crowded places, going into shops which may be crowded with lots of people that we've been avoiding thus far. So I think there's going to be lots of new challenges.
Yeah, definitely. Thank you. And so little is known about this virus and its long-term impacts. And you touched upon it then, you spoke about some research which you've been doing. Could you tell me a bit more about this research and any research being done at King's that's trying to understand more about fatigue, either induced by the virus or more generally from the experience of lockdown and the pandemic?
Well, we're doing a population study. This is a study that's led by Kavita Vadhara in Nottingham. And we're looking at the population and how the pandemic is affecting their levels of stress, anxiety and depression. We've done the first wave and we're now following people up 3 months later to see how they're faring. But what we found was that if you were female, you were more likely to be distressed, and also if you were younger. So the younger people seem to be struggling a little bit more. We also found that people who felt lonely and were worried about getting COVID, that they were more likely to be distressed, not surprisingly. Where, in addition to asking people about how they're feeling, we're also measuring a hormone called cortisol. We know that's associated with stress and fatigue. So we'll be looking at cortisol at baseline. That, as I say, that stage is already complete, but we'll also be following them up and then measuring cortisol again to see whether that has changed with the changes in the government recommendations.
Thank you. And so as you said, you're going to be kind of following up on with that research. And is the idea hopefully that you will inform, I guess, how we respond to this pandemic, or is it for future pandemics really that we're thinking about now?
Well, I think undoubtedly the research findings will potentially inform interventions that could tackle the consequences of the pandemic, which I think are going to last some time. And of course, we've no idea, have we, what's going to go on in the future in terms of another spike in the number of people who are getting infections. And lots of other challenges. So hopefully it will help us in terms of developing interventions for managing both stress and anxiety, depression and fatigue in the foreseeable future, but also hopefully will inform us in terms of other viruses that may actually occur.
Fantastic. Thank you very much. That's been really interesting. Thank you.
Thank you.